Hi everyone. Okay, today I'm going to teach you or show you how to treat shoulder impingement, shoulder pain whenever you lift your shoulder overhead going this way and you feel a sharp aching sensation over here. Sometimes it can radiate over here. And we're starting right now. So by the way guys, I'm Gorby, and if this is your first time watching here on this channel and you wanted to learn more of some exercise tips, physiotherapy, and movement exercises to keep your body healthy and pain-free, please don't forget to click that subscribe button and notification bell so you won't miss out on anything. Okay, so this is Romel and he's experiencing shoulder pain or shoulder impingement on this area. So whenever he tries to lift up his shoulder overhead, especially when he lifts up heavy object, he feels a sharp sensation right here on the shoulder. So the first thing that we need to do is assess first, where does his shoulder pain coming from? So what we're going to ask him is to sit up straight and then just lift the shoulder here. This way. Do you feel pain here already? May masakit na? Okay. Now what I'll ask you to do is, I'm gonna push his shoulder down going this way, and then he's going to resist my force. This will then test his rotator cuff. So it's a contraction of his rotator cuff right here, and then we'll see if it will elicit pain, and if that's the case, it could be that his rotator cuff is being compressed or impinged inside the shoulder joint. So I'll try to push this down and then resist my force. Ready, set, and go. You feel pain? Alright. Alright. And relax. Now the next test we're gonna do is we're gonna ask him to lie on his back, head over here. Higa tayo. Tapos naka-tihaya, face up. Dito yung ulo. Tihaya. Now the second thing we're gonna do is we're gonna check the amount of internal rotation on his shoulder. So we're gonna check how much rotation or internal rotation this one he can do. So for us to test that, just relax, and we're just gonna move the shoulder. Just relax your shoulder. We're just going to move the shoulder going this way. Now what you don't want to see here on this test is this shoulder lifting off. So we're just going to push it down or hold it there and then rotate again. This is the amount of internal rotation that he can do. So it's a little bit limited for us. Tight, yeah! So what we wanted to do is gain that range of motion towards this way to create space on the shoulder so that eventually the rotator cuff here in the back won't be impinged. So how are we gonna do that? But before that, we're gonna do one more test. We're gonna move the shoulder going this way and then check the amount of horizontal adduction on this shoulder, or shoulder moving going this way. So from here, we're just gonna move the shoulder this way. Now what we don't want is the lifting off of the scapular blade right here. So I'm gonna hold it down and then move the shoulder this way. Now the max that he can do is just going this way. This elbow should be able to touch his nose while this scapula is pushed down. But for him, it's quite stiff or limited. So goal of the treatment is to increase the internal rotation of his shoulder by doing some soft tissue work on the external rotations of his shoulder. Okay, so for us to increase internal range of motion of the shoulder, we're going to release this muscle. It's called the infraspinatus. So if we can just zoom the shoulder right over here. So it's this point right over here on the shoulder. So how are we going to do that? So I'm going to place my elbow around this muscle. So from here, just going to place my elbow here. And then I'll ask him to rotate his shoulder internally, going this way. All right. So ready, set, and go. Good. 1, give me 10 reps. 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Next thing is to release the neighboring muscle, which is also external rotators. So we're gonna just move from here, going towards this area. Place my elbow there. And then he's gonna do again that movement. It's ang tigas. So, and go. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright. Now just relax for me. I'm just going to repeat the whole sequence again. Ulitin ko lang. And go. Isa pa. Okay. And then here. And alright. And then we're gonna test again his shoulder range of motion. So, Romel, I want you to lie on your back. So, tihaya. And then dito yung ulo. Head over here. So, we're gonna check again the range of motion of his shoulder. So, from here, let's see if the shoulder still lifts up. So now he has more range towards internal rotation. And then let's see here. Now he can go much farther. And then we're gonna test again if his shoulder is still painful. So I want you to sit down, facing this way. Upo tayo. And then just sit up straight, arms like this. Upo tayong diretso, kuya. Tapos nakaangat lang yung kamay. Ito lang. Yeah. Now, same thing. We're gonna push it down, and then he's gonna resist. Ready, set, and go. Is there any change in pain? Masakit pa ba? Okay, that's good. So right now, he doesn't feel any pain while doing external rotation. Now, additional treatment that we can do. So his shoulder is tilted this way, so we want to peel it going back. So he can come here. You see his shoulder is going this way. So we wanted to peel that shoulder back, going that way. So the way we do that is we're gonna do some release of this muscle right here while asking him to tilt back. So kuya, so whenever you feel my hand going this way, I just want you from here, just want you to do this motion. Okay? Ready, set, and go. And come back, balik. And go. And come back. And just relax. So again, from here, so I'm peeling it back. No need to move. One more. Alright, now let's test it again. Resist my force. Ready, set, and go. Fight. How's the pain? Okay, good. Now try to raise arms up. I'm gonna push it down, resist my force. Pag ganito ka, and go. How was it? Alright.